What is a multiple mini-interview, or MMI for short? Instead of the traditional single-panel interview, MMIs consist of a series of short stations, which are individual rooms in which one interviewer and one interviewee have a short conversation, typically between 5 and 10 minutes. Each station will present you with a scenario or question to evaluate different aspects of your suitability for graduate study in your chosen profession. These stations can cover a wide range of attributes such as communication skills, ethical reasoning, problem-solving ability, teamwork, empathy, and critical thinking. Applicants rotate between 10 or so stations. At each station, you'll be given a scenario or task and be prompted to respond, discuss, or address the situation described in each one of them. MMI is prominent at a few dozen medical schools in the United States, including the University of Minnesota's Twin Cities campus. Dental schools and physician assistant schools employ MMIs less frequently, but you may still encounter them. What is MMI for? This format aims to provide a more comprehensive and well-rounded assessment of an applicant's aptitude for the medical profession, as it evaluates how they handle diverse challenges and interact with different scenarios. The MMI format offers a few benefits, including reducing interviewer bias and providing a standardized evaluation process. It helps medical schools select candidates who not only possess strong academic records, but also exhibit the interpersonal skills, ethical judgment, and problem-solving abilities essential for success in team-based, patient-centered care settings. How are MMI interviewees evaluated? Interviewers are typically instructed to evaluate each response based on 3 categories. Each of these categories is pretty expansive, so I'll do my best here to provide some guardrails. The first category is communication skills. In a previous episode, we talked about 5 concepts, TRACE for short: transparent, responsive, affirmative, concrete, and empathetic. What do these terms mean? By transparent, I mean your response shows you are not afraid to state a strongly held opinion when asked. Rather than trying to avoid the possibility of conflict, you phrase your stance in terms of affirmative values and with empathy for people who might hold contrasting points of view. Being responsive means that you make a reasonable amount of eye contact, keep a reasonably upbeat and attentive facial expression, communicate openness in your physical posture by sitting tall but not rigidly, and maintain a reasonable rate of speech. You also communicate and check the accuracy of your understanding of the prompt, topic, or question. After speaking to a prompt, you might check in with the interviewer on the general adequacy of your response, for instance by asking, "Did that speak to the question? Do you have any questions for me on that?" To be affirmative means that your response communicates positive affirmative views, desires, and goals, rather than avoidant ones. By concrete, I mean that your response reflects on experiences and real-world details at least as much as ideas or concepts. When you're being empathetic, your response communicates a sensitivity to other people's experiences, values, and needs, including not just those of the interviewer, but also those of people in a given scenario, whether hypothetical or real. The second big category in MMI interviews is the quality of argumentation offered in each response. Notice that the question here is not, "Is this response correct?" Rather, the question is whether the response makes a case that is easy to follow because it's A, clearly and concisely stated, but also substantiated with a basic level of detail. B, it communicates an understanding of the ethical and practical implications of a given position, especially by identifying who is likely to be directly and indirectly impacted in a given scenario. And finally, C, it shows that you are familiar and comfortable with ethical and practical problem solving, as well as empathetically relating to people whose backgrounds and viewpoints differ from your own. Here are other essential tips. 1. Read each prompt at least twice. Make full use of the 1 to 2 minutes you have to prepare outside of each station. 2. Remember that your interviewer is, on average, more likely to remember the first thing you do or say than anything that comes afterward. Use that to your advantage by offering a warm, professional greeting and briefly recapping the station's prompt, all of which communicates responsiveness and empathy. 3. Along the same line, your interviewer's impression of you is likely to be impacted by the last thing they experience. Don't forget to express appreciation for the opportunity you've just had, wish your interviewer well, and say a cordial goodbye. 4. Posture and breath matter, not just for how you come across, but for your own experience of each conversation. Practice keeping your shoulders high and open, taking breaks between sentences to breathe just a little, and smiling a bit no matter how nervous or apprehensive you are. This is how you use your body to trick your mind into feeling a bit more at ease. 5. Practice getting comfortable with silences, rather than filling them with words or and the like. It's okay to take a moment or two to think before you start a new sentence. So let's explore a few prompts and go over some different responses. Here is a common MMI prompt.
Your patient is a 26-year-old married female coming in with complaints of low back pain. She says she took a fall down some stairs. Upon examining her, you find bruising on her low back in the area of her kidneys, but also see bruises on her arms and older bruising on her upper back. She has come in twice before over the last 14 months, once for cracked ribs, she says she fell, and the other time she had a fractured wrist. She says she slipped on the ice. You strongly suspect she is a victim of domestic violence. Discuss with the interviewer how you would bring up your concerns and maintain her trust.
Here's a pretty optimal response. It's transparent. There is no hedging or talking around the problem. It's responsive in that the interviewee is attuned to the interviewer and expresses an appreciation for the prompt. It's affirmative in that it puts the patient's safety and well-being first. It stays concrete by focusing on the patient and the details of the conversation with her. And maybe most importantly, it puts empathy first.
So I'm really glad I got this scenario. It offers a lot of delicate ethical considerations, and it's interesting to tease out. From what I read, the scenario involves a young female patient who is partnered and comes in with lower back pain. She's got some injuries that are consistent with domestic violence, but she attributes them to accidents. So this is a situation that could easily lead to much more serious injuries, even death, but it's also not something, you want to be intrusive about. So first things first, I'd make sure we're in a comfortable and private setting where the patient can feel at ease talking to me. I'd start by asking her about the recent fall she mentioned, just to understand what happened and how she's feeling. So I would offer something to the effect of, I understand that accidents can happen to anyone, but I've noticed that you've had a few injuries over the past year. Sometimes when we see patterns like that, it's important to make sure we're addressing all aspects of your well-being. I might add something like, I've noticed that you've had a few injuries over the past year, and above all, I'm here to help you. Sometimes a pattern of injuries like this can raise concerns, and I want to make sure you're safe at home. So if you don't mind, I do want to ask, are you safe at home? However the patient responds at this point, I'd want to stress to her that it's absolutely okay to reach out for help. I'd want her to know that, difficult home situations are really common, and a little bit of outside help can go a long way. I'd also want her to know that whatever she shared with me would be treated with care and confidentiality. I might add, if you're comfortable, we could talk about some resources that might be available to help you. There are local support groups, for instance, and shelters, and helplines that can offer assistance to people who might be in situations involving domestic violence. I'd stress that she's not alone in this. I might offer something like, whatever you decide to do moving forward, I'm here to support you. Your well-being is my priority, and together, we can come up with a plan that feels right for you. So that's my response in a nutshell. I'd make sure the patient knew I understood the seriousness of the situation, but also respected her autonomy and put her safety and well-being first. Did that all come across clearly enough? Do you have any questions for me?
So here are 5 other essential tips. 1. Read each prompt at least twice. Make full use of the 1 to 2 minutes you have to prepare outside of each station. 2. Remember that your interviewer is, on average, more likely to remember the first thing you do or say than anything that comes afterward. Use that to your advantage by offering a warm, professional greeting and briefly recapping the station's prompt, all of which communicates responsiveness and empathy. 3. Along the same line, your interviewer's impression of you is likely to be impacted by the last thing they experience. Don't forget to express appreciation for the opportunity you've just had, wish your interviewer well, and say a cordial goodbye. 4. Posture and breath matter, not just for how you come across, but for your own experience of each conversation. Practice keeping your shoulders high and open, taking breaks between sentences to breathe just a little, and smiling just a bit, no matter how nervous or apprehensive you are. This is how you use your body to trick your mind into feeling a bit more at ease. 5. Practice getting comfortable with silences rather than filling them with words. It's okay to take a moment or two to think before you start a new sentence. In the interest of transparency, I'd like you to know this episode was created with help from ChatGPT and Wondercraft.ai. Thanks for listening.